it's Dr. Tracy with Radiance Functional Medicine with a 3-Minute Thursday. And we're going to continue our conversation on fertility. This is an actual patient of mine that I'm sharing with you with her permission. Now, this 34-year-old woman and her husband had been trying to get pregnant for about 2.5 years. After about 1.5 years, they'd found their way to a reproductive endocrinologist in an infertility clinic, and they had both had a very big workup, and there was no etiology that could be found for why they were having trouble conceiving. They had done 1 round of IUI, and they were contemplating, which was unsuccessful, and they were contemplating in vitro fertilization, but this would wipe out their savings and then some. So they were a little bit hesitant to go down that route right away. Now, a friend of theirs was a patient of mine, and she had suggested that perhaps they come in, and they decided to give it a try. So after our initial visit, we did tweak her diet just a little bit. We eliminated some processed food and substituted water for diet soda. Overall, put her on a more anti-inflammatory style diet. And then we implemented some stress management techniques as well. And then for lab testing, we did what's called a menstrual map. Now, with the menstrual map, you collect your urine sample every other day for a month, and it will plot out your hormones. So a normal graph will have an estrogen spike, and then the estrogen kind of comes down, goes up just a little bit in the second half of the cycle. And then your luteinizing hormone, or LH, will spike, and this signals ovulation. Ovulation will occur within 24 hours after that. And then the progesterone will start to come up at that time, and it'll stay up. Now, it stays up. It creates a very secretory endometrium, one that is nice and lush and conducive to the embryo implanting and then to nourishing and growing a baby. So if pregnancy takes place, this is going to stay up. And if pregnancy does not take place, it will drop down and cause a menstrual period. So in our patient, we found something that is very common in women today, and it's called a luteal phase defect. So her hormones looked something like this. So she had a little later estrogen spike, and the estrogen came down some. And then she did have a spike in her LH. It was not very, very big, but she did have a spike in LH. And then her progesterone levels came up, but then they dwindled back down through the second half of the cycle, and she remained estrogen dominant. Now, you could see where this would not be conducive to the embryo implanting with that low estrogen. So we took her, she ovulated late, about day 16, and we put her on a bioidentical progesterone, which looks just like our progesterone, orally, days 16 through 28. And then we also used an herb called Vitex agnus cactus, or chaseberry, and we had her on that for the entire month of her cycle. And after 4 months of this treatment, I'm happy to report that she's expecting a baby girl. She's almost 30 weeks pregnant at the time that we are shooting this video, and she and her husband are very happy. Now, here at Radiance Functional Medicine, we take a slightly different approach to hormone balancing, but it does work very well with Western medicine and with the reproductive endocrinologists. So if you're having trouble in this area, we'd love it if you'd give us a call, because we'd be happy to help. Okay, bye for now.